you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Alex. This month is Cord Blood Awareness Month, y'all. So today I want to talk a little bit about donating blood. Now, I can't donate cord blood because that is specifically related to the blood from a baby's umbilical cord, and I don't have access to that right now. But I am donating my own blood next week, and I want to talk about what that process might entail, as well as what you might expect from different types of organ donation. We all go and check that little box, or choose not to check it, when it comes to deciding if we're going to be an organ donor on our licenses. But ultimately, what does that really mean? How do we register, and what might that process look like? Which organs can we even donate, for that matter? We're going to talk about all of that today. So, first step, for organ donation, you can donate a bunch of different organs in your body. And not even just organs, but also other tissues, like your blood, or skin, bones, and also your eyes. If you go to organdonor.gov, you can also learn about this extensively, but I'm going to go through the questions that I have, for the most part, and the information that I have researched this week. But if I don't cover something, and you want more information about it, definitely check out organdonor.gov. According to this website, 156 million people in the United States are registered as organ donors. For perspective, there are about 328.2 million people living in the United States, according to the numbers from 2019 from the U.S. Census Bureau as well as Eurostat. So that's about 47% of the U.S. population who have signed up to be organ donors. However, 109,942 men, women, and kids are waiting for an organ that could save their life. So there are many people who are registered to give their organs, but for many of these organs, you can only gift them if you are brain dead or if your heart has stopped. That's not always the case, though. So, first step, what can be donated? Well, there are several different organs and tissues that can be transplanted, and we are developing the capability to expand that list as time goes on and we make more progress with modern science. Right now, if your organs go to 8 different people, or one person gets one of each of the organs that you're able to donate, then you can save up to 8 lives. And different components of your body can also be used to enhance the lives of 75 more individuals. So those life-saving organs are those 8. And then there's also things a lot of us take for granted that others can really use by having access to the recyclable bits of our bodies. Most of the time, organ donors are deceased, as I mentioned earlier, but you can have some organs donated by living donors. If you are a living donor, you can donate 1 kidney, 1 lung, a portion of the liver, a portion of the pancreas, or your intestine. If you are a deceased individual who is an organ donor, you can donate both kidneys, both lungs, your liver, heart, pancreas, and intestines. And in 2014, they added hands and faces to the organ transplant list. And we'll talk about that a little bit more in just a minute. But first, I want to continue with the other types that we see more commonly, like your corneas. So you can donate your corneas, a component of your eye that covers the iris and the pupil. It's that little clear lens-looking component. Some folks get their corneas injured from just an injury, but other folks have problems with their cornea because of disease or even birth defects. If you get a cornea transplant, then the doctors go ahead and remove that diseased or otherwise injured cornea with a new one from a donor. These types of transplants have been performed on over 1.8 million people since 1961, and it has restored their sight. Over 95% of all corneal transplants are successful in restoring that individual's vision too. They don't really have to match either, like organ donors need to. So as we discussed in our episode on blood and those blood groups, you have to have a specific type. There are 8 different blood groups when you combine the Rh factor with the ABO blood groups. And depending on the type of blood group you have, you can either be a universal donor or a universal recipient, or you may only be able to accept from certain groups. Donors for corneas, on the other hand, are completely universal. Your blood type doesn't have to match. Your eye color also doesn't have to match. Your age and how good your eyesight is, that doesn't matter either. People can donate their corneas almost exclusively across the board. The only exceptions are really for people who have infections, or if you have a highly communicable disease like HIV or hepatitis. That is fairly similar to many different body donation programs, whether that be donating your body to science or donating it to mortuary classes, anatomy classes, forensic anthropology decomposition facilities. If you have a highly communicable disease like HIV or hepatitis, those are generally the criteria they use to exclude individuals for the safety of the people who work there as well. It's not meant to be exclusionary to be mean or anything like that. I think a lot of folks think about whole body donation for like the medical sciences and such as being something that's like, okay, well this is like a burial, so why does it matter if the individual has highly communicable diseases? We still bury or cremate people who have HIV or hepatitis, right? But that's the thing about body donation instead. It's important to be very honest on that paperwork because the people who are handling the bodies are following certain protocols to maximize their safety while also making sure they're maintaining scientific integrity. But a lot of it does involve a lot of in-depth contact with the body, just like you would see if you were having a surgeon get in there to donate an organ, to excise an organ and prepare it for a transplant. And, of course, with transplants, they're also going into another living human. So you want to make sure that you're not giving or passing on that disease to that individual. But I do want to make sure that I clarify that so that we are all on the same page about why, no matter which type of organ or tissue or body donation you may end up selecting, that it's very important to be upfront with the paperwork. And sometimes certain facilities may have options available, like being part of a cremation study. So they may not be able to take your donated body out onto specific contexts, but they may very well be able to still utilize your gift of your body in other types of studies. So if organ donation isn't an option for you because of one of these highly communicable diseases, I encourage you to still seek out another type of human body donation, a type of medical donation. There are a lot of different options out there, and a lot of times, if they don't have the answer for you, they may be able to guide you in the direction of someone who will. There are options available. Unlike organ donation, though, your cornea donations can be recovered several hours after death, and they can be stored. A corneal transplant can be performed within 3 to 5 days following donation. So for a lot of different organ transplants, you would need to obtain the organ right after death or preferably beforehand. A lot of organ donations are performed after an individual has been declared brain dead, but they are still on certain machines that help the blood and oxygen continue to flow through their body to maintain the structural integrity of the organ and make sure that it is still optimal before they go to transfer it. Now, you can also donate the white part of your eye, the sclera, in addition to your cornea. And the sclera is used in operations to rebuild the eye. So if you're interested in learning more about donating your eye or your cornea, then you can also check out the Eye Bank Association of America. In addition to that, you can also donate certain tissues. A lot of donated tissues are really important for enhancing the quality of life of folks. So organ donations, those are the ones we think of when we think about donations, because those are the life-giving qualities or the life-saving components of the body. But there are also folks who can greatly have an enhanced quality of life from obtaining other tissues as a gift from you to them. If you are an organ and a tissue donor, again, you can enhance the lives of up to 75 people. In addition to those corneas and the sclera and those life-saving organs, you can also donate your middle ear, your skin, heart valves, veins, cartilage, tendons, ligaments, and bones. So they can store these in tissue banks and use them to repair people's sight or burns, their hearts. They can replace entire veins and also mend damaged connective tissue and cartilage. It's pretty wild the way this all works. And if you are interested in donating your body parts, you can still end up donating the rest of your body to a decomposition facility, like a forensic anthropological decomposition facility. They're very commonly referred to colloquially as being body farms, but forensic anthropologists do prefer the term decomposition facilities. And if you have donated your organs and or your other tissues like your skin or your ligaments, even parts of your bones, which is what forensic anthropologists tend to focus on, you can still typically donate your body to a forensic anthropology facility. They're primarily interested in your skeletal anatomy, and even if not all of your bones are there, that doesn't really matter for forensic anthropologists. All of that data is valuable data, and they always appreciate those gifts from other humans. So if you are interested in donating your organs, but you felt conflicted about whether to donate your organs and tissues or donate your body to science, you can do both by donating your organ and your tissues and your eyes and face and hands and stuff, and still give the remains of your body to a forensic anthropology facility that can still use your gift to further their data and help find individuals who have gone missing and passed away, and also tell time since death in different contexts, and also help out with just skeletal anatomy in general from known populations. It's an amazing gift, and you have options. We're going to go on a quick break, and when we come back, we're going to talk about the different tissues that can be donated, including bone, skin, etc. Stay tuned.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
Different types of donations, whether that be organ, full body, cornea, and we started to dip our toes into tissues. So as we discussed, you can use these different types of tissues in the body to save a ton of different folks and enhance their quality of life. We think often of heart transplants as being the entire heart, but you can also transplant heart valves to save kids who were born with heart defects and adults who have damaged heart valves. Skin can also be a really great way to help people who have very serious burns. It can even save lives by stopping infections in their tracks. A lot of folks nowadays get artificial joint replacements, so like a hip replacement or a knee replacement. I've seen that a lot in the skeletal remains of individuals who have gifted their bodies to forensic anthropology centers. And it is very interesting data to be able to see that too. So keep in mind that you might go ahead and receive that artificial joint replacement or have that bone replaced completely. And that might be due to illness or injury, but you can still donate other parts of your body to science. And perhaps, if you ask your doctor beforehand, you may be able to do something about choosing the disposition of those individual bones that are removed as well. While teeth often fall out on their own, I would be remiss to not mention the concept of saving those and donating them to a forensic anthropology program or to a dental school. It's very helpful for the students to be able to identify these different teeth specifically, whether they came from the left or the right, or the mandible or the maxilla, the top or the bottom. So that is also something that you can do that is generally relatively painless. I did forget to ask my doctor when I had my wisdom teeth removed, and I woke up crying through a mouthful of blood and really doped up on the medication they gave me to put me under. And I was just crying, absolutely, because I apparently asked if they could give me the teeth, and they told me that they'd already put it into the biohazard sharps container. And I was distraught in my state of now missing 4 teeth and just bleeding everywhere and still coming off of the medication. So ask beforehand. There might be some paperwork that you need to fill out, just in case you're interested, so you can learn from my mistake. And, totally miss out on waking up crying with a mouthful of blood. So, there is that. On the other hand, you can also donate tendons. Tendons attach bones and muscles to each other, and they can be donated to help rebuild those damaged joints. Ligaments are attaching the same type of material to another of the same type of that material. So by that, I want you to think of ligaments as connecting one bone to another bone, or one piece of cartilage to another piece of cartilage, or even connecting other organs to each other. So those are going from the one type to the same type, whereas tendons go from one type to a different type. So think muscle tissue to bone tissue, or just muscle to bone. Some tendons also attach muscles to other structures, like the eyeball. So I always think about that as tendons being 2, and the ligaments as being not tendons. And that is how I have remembered it over the years in my anatomy classes. And it's just a really simple way to remember it if you are interested in that. Most people can also donate their tissue when they die, and a local tissue bank is generally notified by the hospital or the medical examiner / coroner or a funeral home if there is a tissue recovery that needs to take place. So if you have your organ donor status all set or your tissue status all set, then they can notify the local individuals who are there to help recover your tissues. Tissue donation does have to be initiated within 24 hours of death, though. So you can get the cornea several hours after death. Tissue donation has to be within 24 hours, but it can also be processed and stored for quite a while. So that is another one of the benefits for tissue donation. Even if someone in your local area doesn't need that right now, they may be able to use it sometime thereafter. So the timing isn't as big of a deal with tissue donation, and it can potentially enhance the lives of even more people. There are about 30,000 donors each year who provide life-saving and life-enhancing tissues. So if you think about that in context of the numbers we were discussing earlier, there's about 109,000 people waiting right now to obtain an organ that may save their life. And each year, only about 30,000 donors give these life-saving and life-enhancing tissues, even if there are a lot more people who are registered. If you're registered as an organ donor, that doesn't necessarily mean that you are going to be eligible to give folks your organs, as that is usually the case if you are brain dead or have died, and that's when your organs can be taken from you. Otherwise, you're not going to be able to do much donation outside of that one kidney, one lung, a portion of your liver, pancreas, or intestine. Now, I said that in such a way that I do want to backtrack. I'm not minimizing the good that living donors can do. That is an absolute gift that has saved some of my friends in real life too. Any way that you are able to give back can be incredibly helpful. Really, I'm giving you these numbers so that we understand the context of how many people are registered and how that seems initially heartening because it's roughly 47% of the United States. And when you look at that 150-something million people who are registered compared to the 328.2 million people who are making up the population of the U.S., it's like, hey, that's quite a lot. But then we see there's 109,000 men, women, and children who are waiting for a life-saving organ right now, not even these life-enhancing tissues. But we have a problem there because that's only 30,000 per year providing them. And some of those people are going to be living donors. So you're not able to use as much of the different tissues as you can with donors who have passed and gifted their bodies completely in that way. So what it really means is this 30,000 that we're discussing is counting life-saving and life-enhancing tissues. So that 109,000 who are waiting on those life-saving tissues, that 30,000 is a really great start, but it doesn't touch all of them. And some people will still pass away while waiting for an organ. Sometimes their eligibility also ends because they go into an advanced stage of failure, and it can also up the risk that they'll reject the organ. So while 47% is a lot, if you are interested in organ donation and you haven't already registered, I encourage you to go out there and do that today or whenever you update your license next. I know a lot of folks are going out and updating for those real IDs right now, but also let your loved ones know so that if nothing else, even if it's not on paperwork, as the next of kin, they can do that donation for you. They can go ahead and process that and get it initiated for you within that 24 hours after death. You can also donate your hands and face. So this is one of the strangest things I have seen so far, just because I was not super aware of it. But I think that it's also really cool and another hallmark for modern medicine. So in 2014, they added hands and faces to the list of organs or tissues and materials that can be successfully transplanted from one human to another. These are referred to as VCA organ transplants. And VCA stands for Vascularized Composite Allograft. So an autograft is when you get skin or an organ from your own body and transplant it into your own body. So think about that like in the case of having skin removed from a certain part of your body, like down near your thighs or your stomach area, and getting that put on another part of your body that's been burned. Autografts can be really good because they have a lower rejection or failure rate. But allografts are also incredibly helpful, especially if someone has extensive burns or extensive injuries. So an allograft is taking that skin graft or that organ transplant from another person and grafting it onto a different person. So these VCAs are referred to as composite allografts because these surgeries involve grafting many different types of tissue. This isn't just an organ to replace an organ or a cornea to replace someone's cornea. It can be grafting both bone and muscle in there, as well as nerves and skin and the blood vessels. And so the blood vessels is where the vascularized, the V in VCA comes from. So in 2005, they performed the first hand transplants, and they did the first face transplant in 2007. This was made possible largely by the development of immunosuppressive drugs to help prevent the transplants from being rejected. Does it sound kind of weird that we have to suppress our immune system to heal? Yes, but some folks have overreactive immune systems, and other folks may have different components of transplants rejected because their immune system is trying to fight them. So by using drugs or pharmaceuticals to really suppress our immune systems, it can help other individuals obtain and retain a graft or a transplant without it being rejected. As of January 2018, according to organdonor.gov, there were less than 200 VCA organ transplants that had been performed worldwide, but a lot of people have hands or faces now that have been donated to them. So these VCA transplants really do work, and they can transform different people's lives. So if you are interested in that, that is also an option, and you can still likely donate the rest of your remains to a forensic anthropology or other type of medical study facility. One of my friends who just graduated from mortuary school and works in the funeral industry recently told me that mortuary schools also will accept different types of human remains in different stages of having had things donated. That is part of how they learn to prepare your loved ones' bodies for when they have graduated and they are working as funeral directors and such. So you can still go ahead and donate these remains, and you can help them out too. We're going to go on a quick break, and when we come back, we are going to talk about blood donations and how organ donation works. Stay tuned.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
Discussing the different types of transplants that are options now, including donating tendons and ligaments, as well as elements of the hand and face in those vascularized composite allograft organ transplants. So now I want to talk a little bit about blood. So we're going to talk about blood stem cells, cord blood, bone marrow, and also blood and platelets. So first up, blood and platelets are made by your body, and then they typically live through a life cycle like most cells in your body, and then are replaced throughout your life. That's why you can donate blood and platelets more than once, and they recommend donating blood no closer than every 56 days, and platelets every 4 weeks. So whole blood versus platelets is a little bit different in there, and you can donate platelets a lot more frequently than whole blood. As we discussed in our episode on blood, there are 8 different types of blood because of the ABO group. So there is A, B, AB, and O, and then that RH factor of being positive or negative. So AB negative or O positive. Blood can be used whole, or it can be separated into not just your platelets, but also plasma and packed red cells. And these are used in different situations to save people's lives. It only takes about 10 minutes to collect a pint of blood, which is referred to as being 1 unit. But with the testing and screening process, the process of donating blood can take about an hour. What are they testing you for? Well, generally they are testing to see your actual blood type, make sure that you are not sick in any way. And now with COVID-19, they are testing for that too, especially as it relates to antibodies. So I will be giving blood next Monday, and when I do that, they will also be testing me to see if I have COVID-19 antibodies to try to help even more people if I hopefully have developed those. So if you have had COVID-19 and recovered from it, then you very well may have those antibodies in your blood, and you may be able to help out a very specific group of people who could really use that help. So check that out too. Most of the blood banks and the blood collection or blood donation groups that are out there right now collecting blood are giving you these free tests for it as well, just to make sure that that blood is going to where it's needed most. So even if you aren't sure if you have had COVID-19, you can go ahead and donate that blood. They'll test that for you. Most of them that I've seen recently anyway. In addition to blood, you can also donate those platelets. Those are tiny cellular fragments that are circulating throughout your blood, and they help your blood to clot so that you don't just continue bleeding everywhere. Platelets can be donated without donating whole blood, though. So you can give someone just your platelets. So sometimes someone might need help with clotting, but they don't necessarily need any more blood. It's just their ratio of those blood cells and plasma and platelets are out of whack with each other, so they need more of the platelets themselves, not necessarily the blood. So when somebody needs platelets, but not blood, then they typically find a matching donor, and they separate the platelets from the rest of the blood, which is then returned back to the donor. And your body, as the donor, will replace those missing platelets within a few hours. It is that quick for you, and it can save other people's lives. If you're interested in donating blood and platelets, you can contact a blood donation organization. If you go to organdonor.gov, then they have a super long list and can help you figure out precisely what you'd want to donate or where you would like to donate it to. There may be a further intersection of your specific interests, like diabetes, in addition to wanting to donate blood, or if you have COVID-19 antibodies, there may be a specific way that you can donate your blood as well. In addition to your blood and your platelets, healthy adults who are at least 18 years old and up to age 60 can donate blood stem cells. So I know we typically think of stem cells as coming from a fetus, but that is not so. They do not solely come from fetuses. Human adults can also have those. And in order for your blood stem cell transplant to be successful, you have to have a closely matched tissue type, or something called your HLA, your human leukocyte antigen. You need that to be in common with your donor to make sure that you are not going to reject this donation. So what is HLA? We know it means human leukocyte antigen, but beyond that, what is it? I'm going to tell you. So HLA is something that is in your body, and it has different markers. Each of these has a name, and these are letters or combinations of letters and numbers. They're really protein markers on cells in your body. Think of them like planting a flag on the moon, or planting a flag anywhere, for that matter. It's your immune system using these markers, these flags, to recognize which cells belong in your body and which ones don't, because they're antigens. And so that is very similar to what you are seeing with your ABO blood groups, where they have these antigens and they help you to form antibodies against the other types of blood that are out there, against those other antigens. So the HLA are just protein markers like flags, so we could say, hey, you are one of us, or you are perhaps one of them, whatever the other HLA that you don't have may be. So we use this to match patients and donors for blood or bone marrow transplants. So it's kind of similar to the blood typing, but it's a little bit more complicated than that. In order to have your HLA matched with a donor, you both have to have your blood drawn. Then they test your blood in a lab to figure out which specific protein markers that you have, or your HLA type. And then they compare your blood or bone marrow HLA to potential donors to see if there is a match for you. Sometimes it can be really hard to find that match, though, because certain HLA types are more common than other ones. HLA types are inherited, though, so you are more likely to be a good match with a sibling than a stranger. You're more likely to match your sibling. Each of your brothers and sisters, if they have the same mom and dad as you, or they had the same ovum and the same sperm, came from the same individual who was involved in creating you, then you have a 25% chance of being a complete or a full match. You're also more likely to match with someone who has a similar ancestry. That has a lot to do with how HLA is heritable. So we use this a lot in anthropology when we study human variation and adaptation. Now you can use HLA to choose the most optimal donor for you, or you can also use it to help you figure out cord blood units. Your doctor wants to get the best match for you. They want to get the best cord blood unit for you. So usually a donor or a cord blood unit that have a very closely matching HLA to yours is what you're going to get. And we care about this match because it improves the chances for your transplant to be successful. It helps your new donor cells engraft. And that means to grow and make new blood cells in your body. They're not just put in there, but remember, these blood cells are continuously created. So this can be really helpful for making sure that it really kickstarts that process. It's not just a one and done replacement. You want them to then prompt the creation of new ones. This also reduces the risk of getting complications like graft versus host disease. This is called GVHD, and that occurs when the immune cells from the donated cells attack the recipient cells. So graft, that is coming from the cells that were donated, and then versus host, the host is the recipient of the transplant. So that literally just means, hey, your body is rejecting this gift of donated cells. So there are a couple of ways that doctors go about trying to prevent that. One is making sure that you have the closest match possible, and another is by using those immunosuppressed drugs. There are some times, though, when a closely matched donor is weirdly not the best option for a patient. For some patients, a donor who matches exactly half of their HLA works best, and they call that a half-match transplant, which is called haploidentical. So half-matched, half-identical in the transplant. Different transplant centers are going to have different matching rules, though. So if you are looking to donate or you are looking for a match, go ahead and ask your transplant team what that minimum HLA match is at that specific center. So if you're going through Be the Match, then that is going to require at least a 6 of 8 HLA marker match. For haploidentical transplants, then they want you to have 5 of 10 HLA markers in common with the other individual. And that generally ends up being the patient's parent or the child, since you get 50% of your genes from your father and 50% from your mother, and it works the same way for your parents. So people within your nuclear family that are blood related are going to be usually the best matches for you. For cord blood units, that needs to match at least 4 of 6 markers. With these cord blood stem cells, it is coming from the umbilical cord that connected a newborn to the mother during pregnancy and contains blood that has been shown to have high levels of blood stem cells. Cord blood can be collected and stored in large freezers for a long time, and it makes for a really great source of stem cells, especially the blood stem cells. We don't really need that umbilical cord after it's been cut anyway, so if you are pregnant or looking to become pregnant, you may want to talk to your doctor about that ahead of time too, so that they can be prepared to harvest those blood stem cells from the cord blood. Cord blood cells are especially critical for patients who have blood-borne diseases like leukemia and lymphoma. They need those stem cells to save their lives. Umbilical cord blood is super rich with all of those blood-forming cells and can help cure individuals who have cancer. So if you donate your baby's cord blood to a public cord blood bank, it can really help people to get the transplants they need to actually survive. Your baby could be saving someone's life before they're even a year old. It's also safe and free. They're not going to take blood from your baby. They just take it from the umbilical cord after your baby is born. Your labor and delivery aren't affected by it. And when you donate your baby's cord blood to a public cord blood bank, there's no collection or storage costs. So some people donate their baby's blood, their cord blood, to a private company. But that's not really typically a donation. Normally, those are folks who are saving their own child's cord blood just in case they need those cord blood stem cells later on in life. Of course, there is a prohibitive cost to that is, very deeply ingrained with socioeconomic status and different barriers to access. But if you are donating publicly to a public cord blood bank, then they're not going to charge you for collection or storage, and it can save someone's life. They do list the cord blood that's donated by you and your baby to the Be the Match registry, where it's available for anyone who needs this type of a transplant. We're going to go on a quick break, and when we come back, we're going to wrap up talking about cord blood, bone marrow, and peripheral blood stem cells, as well as just the bare bones basics of how organ donation works. Stay tuned.
The GSMC Life and Happiness podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
about cord blood and also other types of blood donations. It is Cord Blood Awareness Month right now, so I wanted to make sure I walked everyone through what that is and what that means for you and your baby and your labor and delivery process. So, again, we don't have to get the baby's blood drawn or anything. It just comes from that umbilical cord itself, which has to be clamped and cut anyway to give your baby a belly button. And then your labor and delivery aren't affected, and it is going to generally be free if you're donating it to a public cord blood bank. Cord blood can be used to treat over 70 different diseases, and that includes blood cancers like leukemia and lymphoma, as we mentioned in our last segment. And so your baby's umbilical cord could really save so many lives of people who have serious and even critical illnesses. You can also get stem cells from your bone marrow. So your bone marrow is that soft tissue on the inside of your long bones. So think your thigh bone or your arm bones, things like that, the bones that are longer in your body. We just call them long bones. These are your major sites for producing blood cells, and it's also where a lot of stem cells are removed from, particularly in adults. So when we talk about donating bone marrow, it's not even necessarily the marrow itself, but rather the stem cells that are within those cavities. You can also get those stem cells that are in bone marrow via peripheral blood. So they call these peripheral blood stem cells, and those cells can be pushed out into your bloodstream after you receive daily injections of a medicine called filgrastim. So that medication just helps boost the number of stem cells that are circulating in your blood, and it provides a wellspring of donor stem cells to be collected in a way that is very similar to blood donation. So it's a little bit less invasive and perhaps also less painful than bone marrow donation. So if you want to donate blood stem cells, you can also contact a donation organization for that specific type of donation. So now that we understand cord blood donation and all of the ways that we can donate stem cells, whether that be from our bone marrow or from cord blood or from the peripheral blood supply, let's talk about how organ donation works specifically. We want to talk a little bit about that transplant process, especially those frequently asked questions, so that you feel a little bit more comfortable and confident in perhaps discussing this with a donation organization or your doctor. So first up, if you are registered as a donor, it's very important to learn about how to become a deceased organ donor. Because although there are millions of people who are registered as organ donors, about 157 million, only about 3 in every 1,000 are actually able to become donors when they die. So it's important to understand how that works. In order to be a deceased donor, you have to die in very specific circumstances. So oftentimes a patient goes to the hospital because of an illness or an accident, like they have some sort of severe head trauma, or they have something wrong with their brain, like an aneurysm or a stroke. And this all results in that person being put on life support to keep the blood and oxygen flowing throughout the body to the organs and tissues. And then the medical team does everything that they possibly can to save that person's life. It's not even a consideration whether or not that person is registered as a donor. At the point where the individual turns out to be brain dead, that is when they are able to remove the organs. And sometimes, despite everything that the EMTs and your nurses and your doctors do, the injuries may be too severe and you could die. So if that is the case, then doctors will conduct a series of tests to determine if you are brain dead. And so this is really meaning that you can't breathe on your own and your brain has no activity. So they'll check your electrodes hooked up to your brain and everything and see if you are active at all. Because brain death is real death and it's not considered to be reversible. It's not the same as being in a coma. Science shows us that someone who is brain dead is not going to recover, at least not with any of the modern technology we currently have. Perhaps in the future something will change, but as of right now, brain death is considered to be irreversible. After and only after the brain death has been confirmed by a doctor and the time of death has been noted, can that organ donation come into play. So when it's time for that, the hospital will notify the local organ procurement organization, often abbreviated to OPO, of all of the patients who have died or nearing death, and that is following federal guidelines. The hospital gives the OPO that info about the deceased patient, and they confirm whether or not they have the potential to be a donor. If they are a candidate for donation, then a representative from that organization will immediately travel to the hospital. Then the representative is going to search to see if the person who is deceased was registered as a donor in their state registry. So that's the one that you are signing up for when you are getting your ID card or your driver's license at your DMV. If that person is not registered and there was not legal consent for donation, like a notation on your driver's license, that little symbol, then they'll ask the next of kin for authorization. So that's why it's really important that you discuss that with your loved ones as well. Because even if you don't have that already planned out and on your driver's license, because your driver's license isn't up for another couple of years, and you didn't understand the process before, so now you want to update that, but you don't necessarily want to go to the DMV in the middle of a pandemic, or you don't necessarily want to or able to pay for a new ID right now when it's going to expire in a couple of years, and you want to wait out that time, or you need to wait out that time. Then you can still discuss that with your family members, and if they are your next of kin, when they are asked for authorization by the OPO, they can communicate your wishes to them. Once the authorization has been conveyed to OPO, then a medical evaluation occurs, and that will involve getting the deceased's complete medical and social history from the family. So you have to fill out very similar paperwork in that manner to donating human remains to different whole body facilities, whether that be for mortuary science or for forensic anthropology or other types of medical donation. A lot of them involve that medical and social history. So in those cases, if you are already wanting to be set up and all ready for these donations, that can be really helpful too, is to go ahead and write out your medical history and social history and share that with your next of kin in whatever way makes the most sense to you, while also protecting your medical data should you feel the need to keep that very private. So that can help them out and help you out and make sure you're all set and can get those organs to the individual to save their lives in a timely manner. Then, once the evaluation is processed and they find that you are eligible to in fact be donated, your organs are eligible for donation, then they contact the Organ Procurement and Transplantation Network, shortened to OPTN. So they operate the national database of all patients who are waiting in the U.S. for a transplant. So the people who initially came in enter the information about the deceased donor into the computer system, and then they search for a match. And the computer gives them a list of patients who match the donor, based on the organ. So it will go organ by organ, and each available organ is offered to the transplant team of the best matched patient. Then the transplant surgeon is going to evaluate whether the organ is medically suitable for that patient, or they may refuse the organ. So for example, if this person has been on the waiting list for a while and they happen to be sick right now or have advanced too far to be transplanted, or they can't be reached in time with this organ because the certain organs have a shorter window to be transplanted in, then it's going to go to the next person. So most organs go to patients in the immediate vicinity of where the organs were recovered, and that's because those need to be transplanted pretty quickly. You need to have them harvested and transplanted very quickly to preserve the vasculature and so on. Others, though, are shared with patients in other regions of the country. So sometimes you can, in fact, reach folks in other parts of the country in time. For recovering and transporting the organs, there are going to be machines that keep oxygenated blood flowing into the organs, and the condition of each of those organs is checked by the hospital staff and the OPO procurement coordinator. So the person who originally came and checked out whether this person was eligible to donate their organs. And then a transplant surgical team is going to replace that medical team that treated the patient before death. So the medical team was trying to save the patient's life, and the transplant team is a different team entirely. So it's not the same group trying to save you and then also harvesting your organs. Those are two very different groups. The process is very spread out amongst different groups and organizations and individuals that go into this. Then the surgical team removes the organs and tissues in an operating room, and that's very important to make sure that they stay sterile and that they are able to be recovered in a safe manner. And then they have additional authorized tissues removed after the organs are removed, if other tissues have been authorized for removal. So you can tell them, hey, I just want my organs donated, or just my organs and my corneas, but not my bones or my skin. Whatever it is that you are comfortable with, you can let people in your family know, hey, I know we think of organ donation as just being strictly organs, but I want them to take everything that they can from me, or everything with the exception of this, whatever is most important to you as an individual. So based on your personal belief system as well. But it's good to communicate all of that. Then they are going to close all of the incisions surgically, and because of that, organ donation does not interfere in any way with open casket funerals. Since time is of the essence for the organs in particular, then sometimes they are transported via ambulance, helicopter, or even commercial airplanes. Then when we get to the point where the organs are transplanted, that operation takes place after the transport team arrives at the hospital with the new organ. So you had the initial medical team trying to save the life, the person who is organizing all of this, the OPO, who saw whether this was eligible and then contacted another group. Then you have the surgical team who removed the organ. Then you have the transportation team to take that organ to the hospital that has the individual who is going to receive the transplant. The recipient is usually waiting at the hospital by then, and they might even already be in the operating room by the time that organ arrives. Those surgical teams then work around the clock as they need to transplant those new organs into the folks who will be receiving them. So I hope you learned a lot today about organ donation. If you are interested in registering as a donor, you can either go to your DMV and get that set up there, or you can go online to organdonor.gov/register.html. That's organdonor.gov/register.html. And it will walk you through signing up online. after which point you can tell your friends and family too. So it's a great way for you to be able to do this from home. If nothing else, do talk about it with your friends and family if this is a decision that is important to you. And if you are able to register online, please consider that as well. You can also check out more frequently asked questions at organdonor.gov. Thank you for tuning in to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'd like to ask you to please subscribe to the show, and writing a nice review always really helps us. Also, if you could please follow us on Facebook, Twitter, and Instagram, I'd appreciate it. Thank you kindly, and have a good night.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.